Hi, Dr. Hulleman. I'm Tamara Ickes, and I'm with the Reflections of Grace Foundation with the DIPG DMG Collaborative. And we are so glad that you're able to take time out and gather with us today, because we are thrilled to announce that we are going to grant you $98,306 to the Princess Maxima Hospital in the Netherlands. And we are thrilled that you are going to use this and be able to advance research for the DIPG DMG Collaborative.
It's wonderful.
So congratulations.
I really didn't know what to expect, so I prepared a whole presentation, and but this is wonderful news.
Well, we're thrilled to be with you today, and you don't have to give a whole presentation, but we do have Heidi Varnes with us, also from the Cure Starts Now, and she's got a few questions for you.
Okay, sure.
Hi, it's so nice to meet you. And like Tamara said, my name is Heidi. I'm with Cure Starts Now. I'm the director of family support there. But I'm also a mother of a DIPG angel who gained her wings just a few months ago after fighting for 53 months. Yeah. So it's researchers like you who fill my heart, because I know that you guys have a passion to help find the cure, and I'm just so thankful for that. I'm here representing 85 families that are in the fight right now, that are just looking for that next breakthrough, and total of 616 families that we support that have already lost their child, but we are fundraising and we are raising money for researchers like you to get your work into the lab and hopefully to bedside. So thank you very much for what you do.
So DMGs are really what we call immune cold. So there are very few immune cells, and that's why immunotherapy doesn't work. But I think that by administering givinostat, and actually we have some preliminary data that already shows it, that the immune environment is getting activated. So you can have a backbone for immunotherapy.
At least it's going to maybe help with the inflammation that radiation causes. So that's a good thing. My daughter actually went through 5 rounds of radiation, over 72 sessions of radiation. So obviously, and I do think that's what helped give her 53 months. So I obviously am a fan of radiation and reirradiation. But if we can find something that stops these tumors in their tracks from the get-go, that would obviously be more ideal. If one was to use this with radiation, and this is probably something that you don't know and hopefully are going to find out, but if one was to use this with radiation, could it be used again with reirradiation or again with immunotherapy? Like if they use it with the first round of radiation, can it be used again later in their journey?
I think both. So I wouldn't see why you can't use it with reirradiation. If it works the first time, then why wouldn't it the second time, like irradiation itself? And the same goes for immunotherapy. Actually, I think that it will induce certain changes that will last for a longer time. And that's why I hope that then you can put immunotherapy into the mix.
And that's what we're all asking for. All of us parents are just asking for a longer time. And that's
as a first step only, I would say.
Yes.
Longer time and then cure, right? That's what we're aiming for.
Absolutely. And we're aiming for that with you, and we're fighting every single day to raise money in honor of our children, to be able to give to researchers like you to help find the cure. And we're just so thankful for what you do.
Well, like I said, I want to thank you as well, because I know how much time and effort you put into it. And it's, I admire you because you also have a family to run, right? So thank you too.
Well, thank you.
It certainly makes it worthwhile to have amazing researchers like yourself who are willing to dedicate your time and your efforts towards these kids. So thank you so much.
Thank you so much.
Thank you.
Thank you.